Welcome dear viewers to the video on immediate release formulations. Many of the formulations are available with the immediate release design. There are various types of formulations like tablets, capsules, soft gelatin capsule, hard gelatin capsules, oral solutions, suspensions, powder for oral solutions, suspensions and granules. So mainly the video is regarding the immediate release formulations for oral route of administration. Simply these are called as IR formulations and these are intended for the oral administration. The immediate release type of formulations or dosage forms are developed for rapid drug release and dissolution of the drug substance from the dosage form without any delay. That means there is no delay or there is no holding of the API in the formulation. The formulation in which the drug release rate is not controlled or the drug release rate is not prolonged or modified are known as the immediate release type of formulations. The drug release and the dissolution is rapid for the IR type of formulations. And mainly the immediate release formulation is made to have a rapid action of the drug in the disease treatment. For example, the analgesics and NSAIDs, non-steroidal anti-inflammatory drugs, are mainly formulated into the IR type of formulations with rapid drug release, so that the pharmacokinetic and absorption should happen rapidly and should give the pharmacological response of analgesia. This is, for example, I have told the NSAIDs formulated into IR type of formulations. The release of the drug is over a short period of time, and this time may be around 1 hour or less, and maybe around 2 hours for some of the formulations containing low soluble APIs. The IR formulations generally release more than 80% or 100% of the API within 1 hour or less time. So this is the generalized information about the formulations which are having the immediate release type of design. So if any question is asked on the IR formulations, like what is the exact meaning of IR formulations, so you can give the answer like the formulations which release the API rapidly or the formulations which release more than 80% of the API within 1 hour or less are called as the immediate release type of formulations. Then what is the reason for making the IR formulation? If you see or if you survey, you will find that 70 to 80% of the oral formulations are immediate release type of dosage forms. These are formulated and researched to get the rapid release and fast action of the drug. The IR formulations are able to start the pharmacological activity very quickly. Some APIs are required to be formulated in the IR formulations. There are many examples of the drug substance classes which are required to be formulated as immediate release formulation. The examples like analgesics, antihypertensives are there, antipsychotics are there, diuretics are there, and many of the APIs are formulated into immediate release dosage forms. The type of IR formulation involve IR tablets, capsules. The tablet may be film coated or maybe uncoated. The capsules may be hard gelatin capsule and soft gelatin capsules. Oral solutions, oral suspensions and oral emulsions fall in the category of IR formulations. Then powder for oral solutions and suspensions are also there, which come in the IR formulation category. Sometimes the tablets are formulated into bilayer tablets, which may be having the IR layer, both the layers as IR layer, or one layer might be extended release and other may be IR release. Granules and sachets are also there in the market, which are having the IR design. Soluble and insoluble APIs with different physical properties and pharmacokinetic properties and physicochemical properties can be formulated into immediate release formulations. Then for immediate release formulations, disintegration and dissolution is very important. Otherwise, if the disintegration and dissolution gets delayed or gets modified, then it will not be a IR type of formulation. So IR formulations can have very rapid release or dissolution or a rapid release of dissolution. If the release is above 85% or above 80% or for example it is 100% within 15 minutes, then it is called as very rapid type of dissolution. And if it is in 30 minutes, then it is known as rapid type of dissolution. Generally, if you consider the composition of IR formulation of tablet or capsule, the components are API, diluents are there to make up the required bulk and to have the manufacturability, then binder, disintegrant, lubricant and film coating. If the formulation is hard gelatin capsule, then the blend is prepared and it is filled into the hard gelatin capsule shell. If it is a soft gelatin capsule, then the liquid medicament is prepared and that is filled in the soft gelatin shell. In the IR formulations, disintegration is the very important thing, and to have the rapid disintegration of the tablet or capsule or the granules, the super disintegrants are used. Mainly the cross carmellose sodium and other super disintegrants like sodium starch glycolate are used in the formulation to have the rapid release. Many of the times for insoluble type of APIs formulated into IR formulation, that time some solubilizers are also used. Manufacturing processes for IR formulation involve direct compression, then blending, lubrication and capsule filling for hard gelatin capsule, slugging method, roller compaction method for dry granulation, and also the granules can be prepared by using the wet granulation approach, which may be aqueous or non-aqueous, and the equipment may be used for aqueous and non-aqueous granulation may be a rapid mixer granulator or by the top spray. Then coming to the factors affecting the dissolution of IR formulations, the key factors are API solubility, API particle size, API BCS class, and if you consider the tablet or capsule formulation, then binder and disintegrant level, type of the binder and disintegrant, its disintegration time, manufacturing process and film coating. These are the common factors affecting the dissolution of IR formulations. Other factors may be formulation dependent like solution formulation, suspension formulation or the soft gelatin capsule type of formulation. Then as the advantages are there for IR formulations, some disadvantages are also there. The main disadvantages are like the side effects are there due to rapid release of the API. Then as the release is rapid, the absorption is also rapid, and that's why the dosing frequency will be there. Like the patient has to take the tablet two to three times a day, and it depends on the category of the formulation. Then sometimes gastric disturbances, nausea, vomiting, and other GI side effects are there due to rapid release of the API. The effect of the API does not last for longer time, and this is because of the IR type of design, and also it depends on to the pharmacokinetic properties of the drug substance. Many of the time the insoluble type of APIs are difficult to formulate into IR formulation with rapid dissolution. Slow dissolution may lead to failure of rapid onset of action. If the IR formulation is failing in the dissolution, that time the motto of that IR formulation will not get fulfilled, and the onset of action will be delayed. Then for some of the APIs which are having low solubility or poor solubility and which are not getting sufficient release or slowly dissolving type of APIs, these are very difficult to be formulated into immediate release type of formulations. And for that some technologies are required to be used for getting the sufficient release of the API and sufficient bioavailability of the API. And those technologies may lead to have a modified type of release. That release may not be rapid like the IR formulations. So these are some of the disadvantages. But as compared to the other dosage form like sustained release, modified release, delayed release, extended release, or control release, the immediate release formulations are much more in the market, and out of oral formulations around 70 to 80% of the formulations are having IR release. So this is regarding the immediate release type of formulations. The dissolution is the key parameter for immediate release type of formulations. Generally, to claim the IR release or to have the IR design, the release should be there in 15 minutes, 30 minutes, or 45 minutes. And if the APIs are insoluble, then the release may go longer than 1 hour also. But in rare cases, the dissolution or release will be slow for IR type of formulations. Otherwise, generally more than 85% release is achieved in 1 hour. So this is regarding the immediate release type of formulations. There are videos available on this channel for delayed release, modified release, and lot of videos are there for dissolution testing for the formulations. So you can go through those videos to have good understanding about the various topics, and you can do the interview preparation through these videos. Thank you for watching the video. Kindly do like, share and subscribe to this channel. Thank you.